All right, it's time to start the next lecture, and this one isn't going to be so much computational, but more decision-making. And so on this particular presentation, we're going to talk about some of the statistical decision-making and errors that you could potentially make. So I have a case for you. It's case number 1. It's about a woman who may or may not have breast cancer, which is, that happens to about 9% of women. So if you read the case, a woman finds a lump on her breast and decides to go for a mammography. When the mammography is performed, the doctor is unsure whether or not it is cancer or whether or not it is not cancer. So I basically say, what are the possible decisions the doctor might make here, and what could be right and what could be wrong, and what would the doctor actually do? Well, you actually already know the answer to what the doctor would do. If they were uncertain, they would send for follow-up testing. But in a statistical way, and the reason I bring this up is because this is a perfect scenario for statistical decision-making. So let's think about what the decisions could be that happen here and how they could impact things. What we need to consider here is what the reality is versus what our decision-making is. So if, in fact, the doctor looks at the lump and says, oh, this person has cancer, and that's the decision the doctor makes, if the reality is she has cancer, that is given a particular name. That is called a hit in statistical terms. A hit is where you say, in reality, something is there, and in the decision is made that it is there. So that would be called a correct decision, a hit. But what if the doctor looks at it and says, you know what, you have cancer, makes that decision, and what if reality, the woman really doesn't have cancer? That would be a mistake. That's called a type 1 error or a false alarm. And obviously there's psychological implications of that situation for the patient as well. If you say somebody has cancer and then they don't, then that can really cause some psychological problems for the person because they don't know at the time that that's a wrong decision. The next decision, the doctor might look at the lump and might say, well, that doesn't really look like cancer. And if in reality it really is not cancer, then you've made a correct no decision. And finally, let's say you look at the lump and you decide, you know what, that's not really cancer. And what if in reality it really is? That would be called a type 2 error or miss. And so this particular situation, if you make a miss here, is potentially quite fatal to the woman. And so you'd really want to try to minimize the type 2 error or miss. And that's exactly what statisticians try to do when they're making decision-making or faced with decision-making situations. In this case, the doctor would basically say, let's go in and do a follow-up so that you could make more correct decisions. You want to maximize the correct decisions, the hits and the correct no decisions. You want to minimize type 1 and type 2 errors. And so by doing the follow-up, you'd be able to make an assessment. Obviously, if the doctor says that to the woman, she knows she's in a gray zone there, and that can cause a lot of psychological distress as well. So this is the statistical decision-making situation applied to cancer and cancer-based situations. Thank you. Bye-bye.